Why is the H. pylori stool antigen test accurate for current ulcers? Imagine trying to find out if a specific bacteria is causing your stomach pain without invasive procedures. That's where the H. pylori stool antigen test shines. This test works by detecting pieces of the bacteria, called antigens, directly in your stool. Because it looks for these bacterial proteins, it only shows up when the bacteria are actively present in your stomach. This is a big advantage over blood tests that detect antibodies, which can stick around long after the infection is gone. So, if you have an ulcer caused by H. pylori, this test can tell you if the bacteria are still there and causing trouble. The reason it's so reliable is because it has high sensitivity and specificity. Sensitivity means it can correctly identify most people who are infected, while specificity means it rarely gives false positives. Studies show that the stool antigen test often has sensitivity above 90% and specificity close to 95% when used with proper cutoff values. This means it's very good at catching true infections and avoiding misdiagnoses. It's also a non-invasive test, requiring just a single stool sample, which makes it easier and more comfortable for patients compared to endoscopy or other invasive procedures. Another reason for its accuracy is that it has been validated against gold standard tests like histology, the rapid urease test, and the urea breath test. These invasive tests are very accurate but requiring special equipment and procedures. The stool antigen test offers comparable accuracy, making it a practical choice in many clinical settings. It's especially useful not only for diagnosing active infection in patients with ulcers but also for checking if treatment has successfully eradicated the bacteria afterward. This helps doctors decide if further treatment is needed. However, it's important to note that in cases where the ulcer is bleeding heavily, the test's accuracy might be slightly reduced. Still, combining it with other tests can improve results. Overall, the stool antigen test is a trusted, efficient way to detect current H. pylori infection because it directly identifies the bacteria's presence, has proven high performance, and is simple to use. This aligns with current medical guidelines that recommend it as a reliable non-invasive method for diagnosing and managing peptic ulcer disease caused by H. pylori. Remember, always consult a healthcare professional for personalized advice and diagnosis.